We are Christina,
Oneida,
Alicia,
Colleen.
Welcome to 4NP's podcast.
This is a podcast by 4NPs. 4NPs, advanced practice nurses, students, and anyone interested in the medical arts.
That's the number 4 NPS podcast.
If you have a topic you'd like to see covered, please feel free to email us at 4npspodcast@gmail.com or reach out to us through our social media.
All right, so how was everybody's week? Everybody have a good week?
It was great.
Yeah? Alicia, what did you do? You started a new job?
Yeah, we haven't really heard from you.
Yeah.
Oh, okay. Well, it's good, but it's just always that transition that kind of makes you feel uncomfortable at first because it's new. I mean, you guys have just been through it, and it's just like, okay, what the heck am I doing? And even though I'm in urgent care, similar to what I was doing in New York, they do a lot of things differently. And so it's just a matter of that. And that can be annoying, I guess, just because you constantly have to ask, okay, where's this? What do you do with this? How do you do this? They don't, I'm used to putting in orders and getting things done because it takes so long sometimes to wait for a provider to put orders in. And here, they really don't want you to do that. They want it to be more provider driven. And I guess they got to a point where they were ordering too many streps, too many urinalysis, too many urine cultures. And it's just they don't want to do that, which is actually refreshing because where I came from, I feel like it was money making for them. And anybody that said anything scratched in their throat, they were like, why didn't you do a strep? So it was expected that if they came in with these symptoms, you're automatically going to do COVID swabs. You're automatically going to do a strep swab because they had some kind of difficulty swallowing, even if it was 2 weeks ago or not 2 weeks ago, but 5 days ago when they started symptoms, they want you to do it because they have any report of anything. Oh, my belly hurts a little bit. Oh, do a pregnancy, do a urine dip, urinalysis. So it's just kind of different. It's a little bit different here, but that's good because they're not just running all of these tests because that fell on us to not only put the orders in, but then to perform the task. So this is nice to be able to do it this way. They're, like I was saying, I think before the other guys came on, but I got my first paycheck and I'm they gave me a $2.50 weekend differential. So I get $2.50 extra per hour. $2.50 extra per hour for the weekend.
That's awesome.
And I get another $2 night differential or whatever evening I'm doing. I'm not even sure what time it starts, but I get an extra $2 per hour for the night difference, which I'm I did not hear of anything like that in my last job. They didn't do anything like that. So it's great incentive. To me, I feel wow, they treat the nurses yeah, because that was extra money. It was another $50 or $60, when I saw it all added up in my paycheck. And I'm that's really good, So I do like that. Oh, they also usually with insurance, you start and it's usually you have to wait 30 or 60 days. My insurance started the next day. I started work the 30th. And because it starts the 1st of the month and I started on the 30th, it defaults literally had insurance the 1st of 2 days after I started working. Actually, it's 2 days. Whereas the last job I had was it was 60 days. It started on the 1st, 60 days after hire. So I remember one of my jobs, I started September 11th and I still had to wait 60 days from the 1st. So it was almost 3 months I was without insurance. This one, I've got insurance already. They already dropped 26 hours of PTO in my accruals. And I'm that's a first too, because the last job I was at, I had to wait 6 months before I saw any accruals. You didn't, it's just different. I like it. It's good different. And again, I'm part-time, so I'm trying to get my 12 hours in on a weekend shift, which is great because now it behooves me to do more weekends because I know I'm going to get an extra $2.50 an hour if I do the weekends. So more weekends are coming for you. But yeah, I like it. It's clean. It's organized. There's instead of where I came from, where there were like 1 or 2 providers, sometimes that closed. Like sometimes you'd only have 2 providers for the whole day, and they would stagger them. Like they opened at 7 and they closed at 9. At 7, you had 1 provider for those first 2 hours, and sometimes even 1 nurse, like me and this other provider, the lone people for 2 hours. And then you'd have some backup that came in at 8 and then 9. But then like around 7 or 8 in the evening, you were down to that 1 provider again. And sometimes it was just overwhelming. Here you've got like at least like 4 to 5 providers. Like when I left, they had 1, 2, 3, 4. I think they had 4 providers, like 4 nurse practitioners, actually 1 PA and 3 nurse practitioners. And they had 5 clinical staff, but they actually used to having more. But it's a big urgent care because they've got.
It's a big problem here in New York. You know that?
What?
Just the staffing. Like Vassar, I think that's the ED. Like there's a huge thing going on there.
Yeah.
The ones at Kingston Hospital are striking.
Yeah.
Like Vassar is like but like when I tell you that there was a mass exodus of ED nurses, and it was just in the paper that the union they're having a huge like strike with the union because the nurses are so done with working and being mandated and always working understaffed. Like when I tell you,
and are they even compensated for it?
Oh, no. When I tell you the complaints, like people don't go to Vassar anymore. Like they have like for the past like 4 months, people like patients have coming in after being in the hospital and they're like, nope, I signed out AMA and went to Kingston, or nope, I signed out AMA and went home, because they've been waiting hours and hours and still not getting seen.
Wow.
Because there's no staff to see them.
So this urgent care, I mean, when I had to leave at 1, obviously, but I kind of was extra for them because she asked me, what can you do? And I said, well, I can come in Sunday, but I can only come in the morning. And she was like, well, take it. This is the manager. And it was a nice and steady flow. I will say that when I look at because they time you, like when you get in, and it's all about like time, like how long are you waiting in that waiting area and how long is the turnover. And I mean, for the morning, it wasn't too bad. I mean, most people were waiting like 15 minutes or less in the waiting area, which is very good, because where I came from, it would be at least 45 minutes to an hour and a half before they were seen, because it was just so poorly run. But yeah, I mean, so far so good. I mean, it's a little further than I would like it. I wished it was a little closer, but we'll see how the winter goes, because that's the whole key, is like traveling in the winter, because I kind of drive up this mountain and it's very windy and like serpentine.
Wow.
Yeah, it's cool when you want to drive. It's like, oh, this is fun, but like it won't be fun in the winter if the weather's bad. But I have to see how it is, because right now, like if there's any traffic, I have to leave at least an hour in advance.
Well, you seem very happy.
Yes.
Welcome to episode 4. This is a continuation of episode 3, and we are talking about contracts today and collaborative agreements. So you got the job, and one of the things that they're going to send you is a contract or an agreement for your employment. And they may send you a collaborative agreement that is part of that contract. I'm not sure if they do collaborative agreements separately. My collaborative agreement is part of my employment contract. There's a lot of things that come with that. Sometimes people have never seen a contract before, and they need to try to navigate through that process. The best thing that you can do is prepare and do a little bit of reading and listen to our podcast, and we'll talk a little bit about some of the pieces of it. But also be ready to accept the offer, but do not give a response. Just say, I would really like to have a day or two to discuss this with my family or my partner or whatever. You can use any excuse that you want, but receive the offer. Like I said, there's going to be a lot of different components of it that you're going to want to look at. Obviously, the salary. You're going to want to look at the time that they're presenting to you. So how many hours are you working? How many hours of administration do you give? Does your job involve travel, and are they paying for the travel? That should be in there also. It should talk about the scope of what you're doing for them. And if it has a collaborative part of it, it'll have information about the physician consultation for you. So who's going to be helping you and guiding you, and what does that look like? And all this language would be different dependent on which organization that you work for and how they run their agreements. But you should definitely read it, look at it, break it down into the different parts and negotiate the parts that don't sit right for you or based on what is important to you, like time, flexibility, the money. One of the things that we brought up in an earlier episode that I wanted to talk about, because I actually just learned a little bit more about this, is the non-compete. So you're always, 99% of the time, there's going to be something called a non-compete clause in your agreement. And that non-compete clause basically says that if you leave the organization for a set amount of time, you may not be able to work as a nurse practitioner in a certain distance for a certain amount of time, 1 or 2 years typically. It may also define the practice. It usually has 3 components: distance, time, and your type of practice. So if you're a pediatric nurse practitioner, it may say that you can't work as a family nurse practitioner, but it may say you can't work as a pediatric nurse practitioner. It'll say once you leave the organization, you can't work within a 20-mile radius as a pediatric nurse practitioner for 2 years. That would be an example of what one would look like. What you need to know about that is you can always negotiate that. And if you break it down into those 3 parts of it, you can negotiate one part or the other of it. So you may be willing to say, okay, I won't work in a 20-mile radius, but I only won't work as a pediatric nurse practitioner, or I only won't work in GI or whatever specialty. You want to make sure that that non-compete agreement doesn't limit you from getting another job down the road. So they can be very broad or they could be very narrow, but you should always negotiate that to get what you need out of it. This contract is about you getting what you need out of it.
I would just say, like Colleen said too, they're obviously, they're thinking about their bottom line. So just, and when they offer you an amount, definitely just say, thank you. I'd like some time to think about it, like Colleen said, and come back and definitely do your homework. Obviously different states and different areas in the state are going to have different compensation that they can offer. But, so it's not just about the money, it's about the benefits. Make sure you have enough paid vacation leave, sick leave. The place I'm at now gives personal days, which is new for me. The restrictive covenants, they vary so widely. The first place I was at was, I think it was 50 miles. I couldn't work within the organization for 2 years, but it was specific to hematology, oncology. The second place was, again, 2 years, but it was only 15 miles. But you have to, read through your contract, read the fine print, because I know of some nurse practitioners who their restrictive covenants are, not just from, the place that they're at, but from, say it's, I don't know, Space Mountain, whatever, because there's, whatever. It's like let's say Northwell, that it's
Wait, what? Space Mountain?
Yeah. Well, that was just saying, I was trying to find something not oh my gosh, hold on.
We lost Christina.
So Space Mountain. Did she really use Disneyland?
Yeah, she loves her Disneyland. Or Disney World.
Disney World, okay.
Oneida, does your contract have anything about emergency coverage in it?
Emergency, for what?
So if Oneida, for some reason, couldn't get to work that day and couldn't see her patients, say she had a family emergency, God forbid, there should be something in the contract that says that that somebody would cover her patients for her. There also should be a section that has something about resolution of disagreements. Do you have that too?
I don't have the emergency.
So would you do remote stuff or would have to make it up that evening or do extra hours?
Normally, just because from when during the winter we did, which was a rare occasion, this has never happened before, from hearing from other employees, the office is never closed, but we had a few bad snowstorms this past winter, and when they closed the office, they just turned everybody to remote, so telehealth visits.
Right, it's normal.
Who was accepting that, and then whoever didn't want to do that then or couldn't do it would have to be was rescheduled.
Okay.
And so somebody in the office does that for you, and then they set you up on a Zoom call or
the office manager. initiates all of this. She does it herself, but we do have the PSRs who were working remotely. But the office manager was the one that would keep us abreast of like, oh, here's that we're going to close or we're not going to close, like even the whole night, And then that morning she said, okay, we're closed. We're going to switch everybody to telehealth. I'll switch your patients. Let me know this. Let me know that. So she was coordinating everything.
Okay. And then what did they do? Like, what if you were sick and you couldn't go into work? How would they cover you? How would they cover your patients for the day? Would they cancel them or would they reschedule them or?
Yeah, they would reschedule them. Just because in our office, in many of the offices, there's no available providers
to cover. Yeah.
Like their schedules are booked out 2 months. We're supposed to have, and this is an unfortunate thing, but we're supposed to have same day visit slots open, but those slots get taken with urgent that are not same day, but like that are patients that need to get in and just there's no availability because there's so little providers. And that's the case. That's happening in many of the offices. It's happening in the Modena office. It's happening in, if I'm not mistaken, the Kingston office. So we're pretty short staffed.
Yeah. Wow.
So yeah, they'll cancel, not cancel, but reschedule.
So they reschedule. So then are they dumping patients on your schedule then since they're so short staffed? Are you finding that they're trying to squeeze in more patient visits?
Well, my visits are pretty much 12 visits because of the way I have it set up in the blocks that I have. But I'm seeing some of because I've created somewhat of a caseload, but most of my patients are Kate's patients because she's out on maternity leave.
Mm-hmm.
So I always knew I was going to get her patients, which was fine. But I'll sometimes get the other provider's patients, maybe one here and there, just because, they're full and they have to get seen.
They're overbooked.
Oh, yeah.
Yeah.
Mm-hmm.
And does your contract have anything about number of patients in it?
So it didn't really have a specific number, but I did ask. And when I did ask on my interviews, it was between 21 and 24. And back then I thought about that and I was like, okay, I could probably do that. Looking and doing it now, there's no way I can maintain that. There's no way.
It's crazy. You can't do that every day.
No, I do 12 to 14 and the 12 I can handle. Because it gives me the opportunity to still do all my other stuff like we talked about, right? The 15, I'm stressed out from morning till night. Yeah. You okay, Christina?
Oh, yeah, sorry. I unplugged my computer to print and I forgot to plug it in and my computer's very old, so I died, so sorry.
Oh, that's what Matt predicted.
Yeah.
Christina, right. Does your contract have anything about the number of patients that you'll see in it? Does it say anything about that?
No, none of my contracts have. I did for my first organization. It might have, but it said, actually I have it here. I don't know if it's specifically stated, but if I were to see over a certain amount of patients, I did get a bonus. And I did start getting bonuses closer to the time when I was leaving. They weren't big bonuses, but, I think anything helps, right? So, let me see where it says specifically. But I don't think there was, a specific, number. Do you have that, Oneida?
Yeah, so the same thing happened with, whenever you go over your expected patient, per day, which is probably 24. Who knows, it was told to me probably 24. Then you get paid
24 patients a day?
Yeah, then you get paid a different amount.
They're basically making it unattainable on a regular basis. Yep.
Right. And my restrictive covenant is for 24 months within a 15-mile radius.
Does it say anything about the type of practice? It should have the 3 components: the distance, the time, and the practice.
Yeah, so both of mine were specific to hematology, oncology. I think I said this before. The first practice was 50 miles. The second practice was 15 miles. But I was saying before my computer died was some people have you can't, work for, say, Northwell, of like within 50 or 15 whatever miles from a Northwell facility for a year or two, which is ridiculous because...
Which is...
Yeah,
insane,
so
right, because these
totally
are huge hospital systems.
So make sure that you definitely read that, and because, they'll try to sneak in whatever they can.
Wow, that's so true.
And does yours, Christina, have a resolution of disagreements? Any clause in there that says what happens if there's some sort of a disagreement?
Yeah, I think for both of them, like, it would be like through arbitration if there was any like disagreements. Mm-hmm. So I found it here. So it says base salary. So I got a base salary, and then it doesn't say specifically, but it says employee is eligible for production bonus. But it doesn't say... it says the production bonus amount shall equal 5% of net professional billings, up to a cap of $50,000 per year. But, there was nothing specific about how many patients I would need to see to, be over that. So I never knew, and so sometimes I would have, like, an extra amount in my paycheck, and sometimes I wouldn't, but I never knew why.
But it's an interesting that it's like a vague calculation, too.
Yeah.
Are they providing that information
it's a calculation,
to you?
yeah.
Yeah, I had to actually specifically ask.
Well, I guess that's one of the things you ask.
Yeah, exactly.
Mm-hmm.
I asked too, but even my nurse like the manager, or not the manager, the HR person, like she broke it down to an extent, but it's dollar, it's all right, $1 something times this, and like.
Yeah. So unless you specifically understand what it is, like, they sent me a piece of paper with a bunch of numbers on it, but I didn't know what they meant or what they pertain to. So it, it was kind of useless. So it's, I think it's about just educating yourself so that what your value is.
I was listening to this really good podcast called The NP Dude. He doesn't seem to be recording any longer. I think he stopped sometime last spring. But the guy is very bright. He's an engineer. He's an attorney, and he's a full-time nurse practitioner. He works in Ohio. So his general bias is towards Ohio, obviously, but he gives out tons and tons of information about contracts and collaborative agreements. He talks about them very often on his episodes, the legalese, the language that's involved in it. One of the things that he said in one of the episodes I listened to, I was binging him the other day, he said that you should request in your contract that you get reports of the patients that you're seeing and the billing codes that you're using, and you should get that at least quarterly. And so they should be providing that to you so that you can be kind of on top of your own, understanding of what you're contributing to the practice. You could take that information, figure out how much money you're making for the practice, and then break that down and use that if you're going to ask for an increase in salary, or you need to have a change in how your compensation is configured. So that's something else to think about.
That's good.
So to talk about that a little bit further, I was in a meeting, and this is all like so much new language to me too. Like, we were in a meeting, and it was a physicians meeting for like the local offices, and that came up because I overheard, listening to the other doctors talk about how that protocol, which is receiving and being told what your billing codes, if what's not going through by the coders, what's being kicked back, and what's I guess before the president of primary care took over, or the VP of primary care took over, or the whatever it is, that was the practice. And then when that person came in, things changed, and it was put on pause, so to speak, for whatever reason. And the providers were really upset about it. They were like, that's our money. Like, we need to know, we need to be aware of what's, like you said, Colleen, our billing codes, what we're making for the company, because we're the ones providing the care.
Right. And you can be sure that the healthcare organization that you're working for, whatever healthcare organization is, they know what every single provider is bringing in. They know what codes they're using. They're on top of that money. And you're entitled to know that. So I would definitely put it in your contract. When I was listening to this guy and he was talking about it, I was like, that has to be in The contract, that like that's a big deal, and I bet it's not in a lot of contracts.
It's not in mine.
Wow. But just again, the importance of like this kind of podcast giving that information, because you don't know what you don't know. And how would you even ask unless you have some insight as to this is what you have to watch out for, this is what you should ask. And just like Christina, what you were saying, like you receiving a bonus in your check and you weren't really sure. All of that, like, absolutely should be in writing. After you see this amount of patients, this is the bonus you're going to get. And like, you know, and if that exponentially increases based on the volume or what, because otherwise you're not going to know. And how do you keep track of, oh, hey, I did this amount and they didn't pay me for that? Like, because you're just kind of like trusting that they're calculating everything correctly. And yeah, so to be on top of your game, that's a lot of work though, too.
It is a lot of work to do, but they should have that set up. I know that at a practice that I worked at for about 12 years, they had probably a couple years in, because I think the systems were new when I first got there and they didn't have this. But there was some point in time when the physicians started getting a dashboard available in their system. And my docs that I worked with, they were checking that dashboard daily. They were on top of their numbers at all times. And I remember hearing them complain. Like, I would know the dashboard was down because you would hear the grumble in the office. Like, they were on it. So, and you know, we're all providers. We need to be on that too. I think as nurse practitioners, sometimes we forget that part of it. And I know Christina and I have been talking about this a lot lately, where, you know, because we're trained as nurses and we're so used to being that employee of a company, when we become nurse practitioners, nobody really tells us that, hey, by the way, you're no longer just a write-off. You're no longer part of the overhead of the organization. Now you're a provider and you're contributing to the profit of that organization. And when you start to understand this about yourself, it gives you a whole different perspective going in. Talking about like salaries and talking about just, you know, how you're contributing to the organization. You should be. I was glad to hear that you said you're part of that meetings, because that's one of the things Christina and I were talking about. Sometimes there's meetings that occur and they forget to invite the nurse practitioners because they think, oh, well, you know, the nurse practitioners, what are they going to? You're a provider. You're a provider just like that physician's a provider, and you're bringing in money just like that physician's bringing in money.
So the good thing about where I'm at, they definitely do not do that under no, like, that's why they changed it from saying mid-level to providers across the board. So I have to say that they don't ever make you feel that way. I mean, at all.
That's good.
But what a busy and constant upkeep of just another area that you just have to be so cognizant of when you're in this type of field, right? Like, there's just so much you have to be aware of and constantly paying attention to, and it's just a lot.
It is a lot. How are you going to see all these patients in a day? And then, you know, it's just enough. Like, Oneida, I'm listening to you talk about this a lot too. It's like, it seems like it's so much just to get through the day. And then you're not even thinking about your own business piece of it. That's the last thing on your mind. But the truth is, you should have some way to be on top of that. So I think adding a clause like that, or making sure something is in your contract that says that you have access to this information. You want a report that says this. If you want it quarterly, you want it monthly, you could put in whatever you want. You know, they're always going to present to you what works best for them. So they're going to leave certain clauses out and they're going to add certain clauses in, because that's contract 101. Doesn't matter what kind of contract you're negotiating for what across the board. Generally, the person who's providing the initial contract is always looking to have the win, right? They want you to look at it and go, oh, I don't want to deal with this. I'm not going to read all this legalese crap. And, you know, here we go. I'll just tell me where I need to sign, and we're going to sign. But we definitely, like, we're all learning here that it's important. You have to read it. And if you don't know what you're talking about, ask another nurse practitioner, ask somebody who's already done it, or do your homework. There is tons of information out there on the internet. I've been looking at it for a week myself, and I found out a lot of things that I didn't really know. So look at the clauses. See, you can add a clause to a contract. You can say to them, this isn't in my contract. I don't have anything in here about it, how my patients are going to be covered in the event of an emergency that I can't be to work. And I want that written down. Sometimes it's beneficial to not have things written down, but like I said, it's always going to be coming in for what works for their angle, and you're going to want to negotiate that and make sure it works for you. And play a little hardball. Expect it to go back and forth, maybe twice at least. So they're going to present you with something, counteract it, and ask for everything. Ask for every single thing, but then know in your heart of hearts what you're willing to compromise on and what you're not willing to compromise on. If you're willing to take the lower salary, but you're going to ask for more money, well, that's great. But then find another piece in something else that works for you. Watch those extra clauses with the, what happens, the non-compete stuff, like what happens after you leave. Also, how much notice you have to give. I think, Christina, you had like 3 months for one of your contracts. That's insane.
Yeah, I had to give 3 months, I think, for both. And then the one I'm at now, I have to give 4 months.
4 months. That's crazy.
Yes, I had 4 months too, and I went back and was like, that's a little crazy. And she said, no, we're in the process of changing that. So they did change it to 3. Remember, Christina, when we were having that discussion, I was like, how much notice do you have to give? Mm-hmm. I thought that was just a little excessive, but it is 3 months also for me.
Does it say in there what happens if you don't give 3 months notice? Do they dock something from you, or does it say what they do?
I think just for the most part, they're not going to pay you out for your PTO. Okay. I think that's usually just I guess they could sue you, but I think that would be more money than just letting you go.
So the answer to that would be make sure you use your PTO before you give your notice.
Yeah. There you go.
Fix that problem.
Exactly. And then the only other thing, part of my contract was the CMEs. For continuing education. I don't know if you guys talked about that, but making sure that you have education and just having the knowledge is powerful. So that's something that should be included in your contract, as far as, it's usually like 2 or 3 days of continuing education time that they'll pay you for, as well as, for the most part, all of my organizations, usually about $750 that they'll also pay towards like the class that you're going to take and the travel or whatever. But it's not a lot of money, but at least it's, a little bit of money to go towards your education.
Wow. Such good information.
Oh, and also education, like tuition reimbursement, right? Make sure that's in your contract.
Make sure vacation, PTO time is in there. You can always bump that up. You can always ask for more. Always ask for 5 weeks. And no matter where you live, also, there's a website called salary.com, and it'll always give you a range. You put in what job title that you're looking at, and then where you live, because it's different by, if you're in a city, obviously your salaries are going to be a little bit higher, but it'll give you at least a range so that you have an idea of what are the nurse practitioners who do whatever making in this, in this area. And it'll show you different job descriptions and show that. It's just a way of educating yourself too, just so you know so you go in and know your worth. I know I had a nurse practitioner tell me I live in New York, not far from the city, and a friend of mine who's a nurse practitioner said to me, do not take less than $120,000 for a nurse practitioner job in this area. Mm-hmm. And there were nurse practitioner jobs that were offering quite a bit less than that.
Right. All right. Well, they're going to try to profit as much as they can, but you have to do the same. Know your worth and know what you're going in for.
Colleen, what was that website again that you just mentioned with the salary?
Salary.com.
Okay. It's really good information.
Yeah. It's a great website. It's, it kind of gives you at least a gauge and a range.
Yeah. And then once you're in the game and you know your salary, you can also put in your information so that it's part of that, conglomeration of information, so you can help others as well. Does it go over like PTO time or is it just salaries?
I think it does have a section in it where you can look at the benefits that would come with that. So it would talk about that. It's just in a different part of, I haven't looked at it in a while and I don't have it in front of me, but I believe there is a section that has that.
Okay, that's good. Is there like, I was trying to find the information for New York as far as being certified. I didn't see a lot of information. Is there much difference between states as far as getting additional certification?
Certification for what?
Like if you wanted to practice in another state.
Oh, so for, and actually, you guys can probably talk about this more than I can, but I've been looking for New Jersey. I used to have a New Jersey RN license, and I let it lapse because I just never used it, and I didn't think I needed it, and that was a big mistake. But I can go back now. I just went back, and I went to reestablish my Jersey license. So it was... I can reinstate it, and I have to go through a lot of the work again. I had to provide them with my diploma, as a check for $345, a certificate of employment, CEUs, and continuing education. I had to meet their standards. I had to certify that they can do an additional criminal background check on me, even though they did one a couple years ago. They did not ask for my fingerprints this time. But anyway, so... basically how it works, if you're a nurse practitioner, you have to have, for New Jersey, you have to get your RN license in Jersey. And then once you have your RN license, I have to pay again on top of it and apply for a nurse practitioner license. So it's a little bit cumbersome for Jersey. I don't know if all the states are like that. That's the state I've been working with.
I know here I had to go through the process of getting the RN license. I had to be fingerprinted again. I had to do the background check again, which was like $85 or something. And then I had to apply for the license through endorsement because I was currently practicing as an RN. And so it was about $120 for that. And then since then, once I got here to Colorado, then I started the process for it's also called Advanced Practice Nurse. So it's an APN. And here, you have to apply for prescriptive authority separate from your advanced practice license. So what they do here is once you pay the fees, so it's another like $120 to apply for the APN, and then the prescriptive authority license is another $240. So I just, finished paying those fees. And what happens is when you get the prescriptive, when you apply for that, it's called a provisional authority. So basically you have 3 years to get 750 hours because you have to go through a mentorship with another provider that has full prescriptive authority before they give you full prescriptive authority. So for 3 years, you're being mentored and you're working under someone that has the full it can be a doctor or it can be another advanced practice nurse. And then once you meet that 750, then you can now go in and apply for the full prescriptive. I don't know if there's additional fees at that point because I'm not there yet, but it's a little bit extra. Yeah. I mean, and I had to apply for an original license here. You can also do through endorsement with the prescriptive authority if you already have 750, or if you can prove you have 750 hours of, that you've been writing prescriptions in whatever state you're coming from. So that would be through endorsement. But because I can't get endorsed because I haven't practiced yet, I have to apply for like an original prescriptive authority. So yeah, it's a little bit different here, but I mean, it's not a difficult process. It's just, going through the forms and providing everything that they need and submitting everything online and then paying the fees and waiting.
Oneida, where did you end up getting your fingerprints?
Oh, it's the craziest thing. That was such a process, right? To even figure out where I was going to go. And I ended up going to a place in Hyde Park, which was like 20 minutes from my job. So I was able to work that in. And it took 10 minutes. It was the most difficult process to find the location and the easiest thing to do.
I think the most important thing about contracts is just to take the time to educate yourself, know what you want to ask for, what to accept, and just take the time. Like, don't take the first offer and know your value.
Know your value. Speak up for yourself, for sure.
Yes.
And yeah, never take the offer as it. If they call you with the offer, or just send it over, say I'd like some time to think about it.
And that's your right, so don't feel uncomfortable.
And don't ever let them negotiate you down and say, okay, so you asked for this. And then they say, oh, we're going to give you this. Don't think that you have to do that because you're new.
Right.
You shouldn't. Don't, because the work that you're going to be responsible to do, you're worth more than what they're going to offer you.
Right.
I think if I could add, I'm not there yet with contracts, but I think when I look at everything that you guys have said, and it's like, don't be afraid of that door closing, because, you advocating yourself is never a lose, so I think letting a door close to gain the experience and then move forward and have that next door open where you do ask and they respect what you want and they give it to you would be just like so much like all it's worth, like that's the important. I think for me, my takeaway hearing from you guys, like when I'm ready, is just like not to be afraid of closing a door. If like just to stand for what you want, to just stand.
Right. Exactly.
And if you have any questions about contracts, or we can find some information for you, please feel free to email us at 4npspodcast@gmail.com.
Dun, da, da, da.
That was perfect.
Thank you for listening. If you like what you're hearing, please subscribe to us and give us 5 stars.
If you have any ideas or comments, please message us at 4npspodcast@gmail.com.
Please follow us on Instagram, Facebook, and Twitter at 4NPs Podcast. That's the number 4NPS Podcast. Subscribe to us wherever you get your podcast, and go to our website at 4npspodcast.com for episode transcripts, resources, and more information about us.
Next week, we'll be sharing an interview we had with Kimberly Odensmeyer. She's a nurse practitioner. She's also the host of the 5-Minute NP Podcast, which is a podcast where she has in-depth conversations with health and wellness experts from around the world. We really enjoyed speaking with Kimberly. We learned so much from her, and we cannot wait to share the episode with you. Please join us. The information in this podcast is for educational purposes only and should not be used in substitute for professional care by a medical provider. The information in this podcast does not represent medical or other professional advice or services. The thoughts and opinions presented on the 4NPs podcast are of the hosts and guests and do not represent those of their employers.